Hi there, welcome to Explain This, a podcast where we try to explain complex things in simpler ways for people of all ages. I'm your host Jin Kim, and today we're going to talk about a fascinating medical procedure with a turbulent history and public image, Electroconvulsive Therapy, or ECT for short. Special shout out to Siggy for recommending this topic for us today. Also, just a brief warning that today's episode mentions suicide, depression, and other mental health conditions. Alright, with that all out of the way, let's get started. If you asked a layperson what they thought one of the most barbaric medical procedures ever invented was, ECT would sit very high on the list, next to things like lobotomies and leeches. You've probably at least heard of ECT in movies and books, where a person with mental health issues, or possibly not at all, such as simply being gay or a woman in the wrong time, gets tied down against their will, then shocked with a strong electrical current to fry their brain back into health. Now, unfortunately, the public image of what ECT is and how it works is grossly warped and tainted, due to horrific and outdated depictions in movies such as One Flew Over the Cuckoo's Nest. It doesn't help that ECT has been misused inappropriately and unsafely in the early days, so even now, ECT has a really bad rap and people shudder at the mention of it, asking how modern medicine could still use such an inhumane treatment. But in reality, ECT's come a long way, making it an extremely effective and safe treatment option for many people with debilitating mental health illnesses that can drastically improve the quality of lives, literally saving lives in many cases. Even so, there's such a massive stigma against it that it can be hard to discuss it publicly without triggering many people. So, with that in mind, in today's episode, we're going to talk about what ECT is, how it works, or how we think it works, and the complicated history behind why ECT is so poo-poo so much by the general public nowadays. Firstly, as always, let's explain what ECT is to you as if you're a child. Your brain is what makes you, you. Yep, turns out you exist not in your heart, but in your head. All of your memories, thoughts, feelings, and personality all sit within your brain. You might hear people talk about the brain as if it is a computer, but actually, it's so much more advanced than a simple computer. It's so complicated that we still have lots and lots to learn about how the brain works, and doesn't work. Because the brain is so complex, there are so many ways it can break, or not work in some way. And not just in ways like making you not able to move your leg or making you forget things, but it can make it look like your personality has been changed from the outside. For example, about 1 in 15 adults around the world suffer from a common but serious condition called depression. Depression isn't just a state of feeling sad, like when you break your favorite toy or your best friend has to move overseas. It's actually a complex state that your brain can get into, where you're less able to feel certain things like excitedness or hope, wanting to do things, or having any energy, or even take care of yourself like exercising or feeding yourself. Depression can really suck the life out of someone, because it can physically disable someone from what might seem like easy, basic life things to other people, like going to work, hanging with friends, or even getting out of bed. In really serious cases, depression can affect people's memory and concentration, distort their senses and how they see reality, like hearing voices, making them not able to physically move, or worse, it can make people think about wanting to end their own life. But as common and serious as the problem of depression is, people throughout history have had a really poor understanding of it, along with other mental health problems. Even now, many people will say insensitive, incorrect things like how people just need to snap out of it, or that it's not a real illness, or that they just need to think happy thoughts and it will all go away. Luckily for us living in 2022, psychiatry, the field of medicine that deals with mental health, has come a long way in the last 100 years, and we have a bit of a better understanding on how to help people with depression. We have talking therapies to help people change how they respond to certain feelings and thoughts. We recognize the importance of social factors like having a supportive family and friends or satisfying work. And we also have different kinds of medications that can help correct the balance of the delicate mechanisms of the brain to slowly get people out of their depression. However, this doesn't mean we've beaten depression. Countless people around the world still suffer from crippling depression, even with all of the help that medicine can offer them. This is where doctors might consider using a treatment called ECT, where they briefly shock a person's brain with a small amount of electricity. Of course, being shocked with electricity is grossly unpleasant, so people are put to sleep and paralyzed first, like when they have an operation. And it's also very, very important that we get permission from people first, one way or another. Anyway, we're not sure exactly how electricity helps fix the brain, but it seems to be really good at doing it. ECT has built up quite a reputation for being much quicker and stronger at fixing people's depression compared to other treatments like medications called antidepressants. We think it might have something to do with stimulating the brain so that it produces the right amount of chemicals that it uses. Now, the electricity also triggers a brief seizure, where the brain gets a bit scrambled like when your computer freezes. Scientists think that the brain has some automatic anti-seizure defense mechanism built in, and that seems to help restore the brain's normal way of working. So in some ways, our brain kind of do work like computers. Turning it off and on can fix some problems apparently. Lastly, we know that electric shocks from ECT helps the brain grow, which can fix long-term damage to the brain that's been building up due to mental health conditions. Yep, turns out depression can physically damage your brain. So ECT is kind of amazing in that it can do all of this fixing in such a short, quick procedure. Even if we don't know exactly how it works, we know how to use it safely and effectively, with decades of research improving techniques and reducing the side effects. But you'll still often hear people poo-pooing ECT, saying it's just pure evil. Why is that? Well, unfortunately, because we've historically had such a poor understanding of mental health and how to help people with mental health issues, that ECT has been misused in its early days. Like being used on awake people, against people's permissions, or on conditions that aren't a mental health issue. It also can cause some important side effects like memory loss, with rare situations where people can even forget important events or people from their life. Because of all of this, ECT in movies has been shown as a barbaric, evil procedure done by cruel doctors and nurses. Because, let's face it looks really dramatic as well when someone's having a convulsion. And it's not hard to make it look like that, because people automatically link being shocked with electricity to very scary situations like being hit by lightning or the electric chair, like in Green Mile. Unfortunately, these depictions are very far from the truth to how ECT looks now. But the shocking images are still around in people's minds, and that makes them angry. So ECT has a pretty bad street rep, even though a lot has changed in the last 50 years, and now it's actually a lot safer and very effective. It kind of shows that no matter how awesome and amazing a piece of technology is, it can cause a lot of harm when used the wrong way, and cause a lot of hurt in people that stops it being as useful as it could be. Welcome back. That was a bit of a longer ELI fight than usual, because the context around ECT is probably more important than the exact mechanism of how it works. So in today's episode, we're going to talk about ECT from two different perspectives. In the first half, we'll talk about the clinical and scientific aspect of ECT. When do we use it? How is ECT actually given to a patient? And what we think might be happening in the brain to produce the therapeutic effects. In the second half of the episode, we'll talk about the historical and social aspect of ECT, the early days of ECT being developed, how it's evolved since then, and why it has so much negative press around it, while debunking some common myths about ECT. Hopefully by the end of this episode, you'll have a much better, fuller understanding of what ECT actually is, why we use it in medicine, and why it's such a controversial topic. So, without further ado, let's talk about what ECT is even used for. As we've talked about, depression is one of the most common mental health conditions around, and I'm certain you will have either experienced depression yourself at some stage in your life, or know someone close to you who has struggled with it, past or present. If you don't think you do, then trust me, someone in your life has. Depression can cause all sorts of issues in a person's life. It can stop them from socializing or being able to work, enjoy things they love like hobbies and relationships, or even basic life functions like eating and sleeping, not to mention the sheer amount of psychic pain people experience during depression. But that's not all. The more severe depression gets, the worse its consequences are, with people developing thoughts, intents, and plans of suicide, or suffering from psychosis, a condition where the brain starts losing its grip on reality, or catatonia, where the brain just shuts down parts of itself and the person looks like they're unconscious. We've come a long way in understanding how to manage depression, using the three-pronged approach of the biopsychosocial model, where we know that we have to often combine medications, psychotherapy, and social support to successfully treat people with depression. But in some cases, all of this is still not enough, and this is what we call treatment-resistant depression. In other situations, the person might already be so severely depressed when they seek help or come to medical attention that they just don't have time for regular treatment, which may take 1 to 2 months before taking proper effect, and their life could be in danger. Both of these situations are where ECT can make a huge difference. ECT is prescribed for people with other mental health conditions as well, such as bipolar disorder, schizophrenia, catatonia, and other psychosis-related illnesses. Most of the time, they reserve it for the particularly difficult to treat cases where medication and psychotherapy haven't worked as well. But sometimes, they might opt for it earlier if the patient prefers it, such as people who've previously had a very good response and would like to skip to it straight away. And it's super effective too. Multiple studies have shown that especially for severe depression and catatonia, ECT is effective between 70 to 90% of the time, with another study showing at least a 50 to 60% response rate. Now, this might not sound as impressive, but in the world of psychiatry, where treatments can be real hit or miss, it's significantly more effective than antidepressant medications. So, how is ECT actually given? You might have an image of Jack Nicholson's character from One Flew Over the Cuckoo's Nest, being restrained by security guards while big round electrodes are placed against his temples, and he's given an electric shock with barely a warning, then having what looks like a very painful, unpleasant convulsion. Fortunately, this isn't how ECT looks like at all in modern medicine. The basis of ECT is still the same. The point is to administer a small electrical current through the front half of the brain. We'll talk more on why this works in a little bit. To do this, we need 2 electrodes connected to the person's scalp, so that the electricity can run between the 2 electrodes. In the past, they did use large chunky electrodes that you had to physically hold against a person's head, but nowadays, they're just tiny sticker dots, much like the kind that we put on for ECGs for the heart. Similar to how defibrillators used to have those dramatic metal paddles, but nowadays have been replaced by just a big large sticker pad. It's much less sexy looking, but safer and more effective because it won't slip off the patient. The electrodes are connected to a device that can generate a customized electrical stimulus, which is the dose of the ECT. Now, ECT isn't like jacking someone's brain up to a car battery or the wall outlet. Just like any medical treatment, there's a specific dose that we give. The device, called a thymatron, which makes it sound like a Decepticon, can customize the duration of the stimulus or pulse and how strong the charge is. The goal of the electricity is to actually induce a seizure in the brain, hence the name Electroconvulsive Therapy. But here's the kicker. Turns out, everyone's brain is a little different, and everyone's so-called seizure threshold is different. Congratulations, you're a unique little snowflake! Now, the seizure threshold can shift as well, like if you're sleep deprived, you're more likely to have a seizure, whereas if you take sleeping pills, it'll make you less likely to have a seizure. Anyway, this means that there's a bit of adjusting and fine-tuning with the dose of the electricity before they figure out exactly the right amount to cause the patient to have a seizure. After your seizure threshold is found, your starting dose of ECT can also be found, and this dose continues, or sometimes increases steadily, during your treatments. They've also discovered in the last few decades of research that the duration and strength of the electricity impacts the effectiveness of the treatment, and the side effects. So nowadays, there's a lot more finesse in what dose is given, unlike the old times when they just used a standard amount of electricity. So that's the general gist of how ECT is given. But at this point, you're probably already raising a finger to point out some issues, like, hang on, you're gonna make someone have a seizure? That doesn't sound fun at all. And you're right, it isn't fun having a seizure, because you can have quite violent convulsions that can make your muscles and limbs flail around uncontrollably. And this is where the other important part of ECT that isn't talked about enough comes in. Anesthesia. No, not the youngest daughter of the last Tsar of Russia, Nicholas II, who had a Disney movie named after her, but the medical procedure where we put people to sleep and paralyze them so we can safely do operations on them. When ECT was first invented, anesthesia was still in its infancy, and we were still discovering how to use muscle relaxants, a type of drug that paralyzes your body, so that your body can't send signals to the muscles to make them move. It actually originates from a plant-based poison called curare that South American people used for poison darts, but that's a tangent. Anyway, the advent of muscle relaxants meant that we no longer need to hold people down on a bed or risk them breaking bones from uncontrolled convulsions, because we can just put them to sleep instead, paralyze them, and let their brain have a seizure without causing any muscle movement. It also means that patients receiving ECT don't remember or feel pain during the procedure, because the anaesthetist will be keeping them asleep and giving pain relief, while monitoring important things like their breathing and blood pressure. So, all in all, if you were to see ECT now, it would look completely different to how you would imagine it from the movies. It pretty much just looks like the person's about to have an operation in an operating theatre, with the anaesthetist putting them off to sleep, then inserting a small plastic tube in their mouth just to help with the breathing. Then electrodes are attached to the head where the electricity will be delivered. Other electrodes are also put on the head as well, so that the doctor giving the ECT can monitor the brain waves and detect when enough electricity has been given to induce a seizure, because you're not going to see it externally. When everything is set up and the patient is fully anesthetized and paralyzed, the doctor can set the device to send a very small electrical charge through the brain. If this doesn't cause a seizure on the EEG or brainwave monitor, then they can just reset and give a slightly higher dose. This is repeated until a seizure is produced. And hooray, we found the seizure threshold. This means that for future sessions, the doctor will know exactly what dose to give to the patient without repeating the whole titration process again. Now that we know the seizure threshold, the actual ECT is given. Typically, we give a dose of electricity that is 50% higher than the seizure threshold, which is enough to guarantee a seizure without unnecessarily raising the side effects. The duration of electricity varies, but typically only lasts from 0.5 to 2 milliseconds. That's 1,000th of a second. So a super brief shock. If you're curious about how much electricity is being delivered, it's usually in the realm of 70 to 120 volts, with 800 milliamps of direct current. This might sound like a lot when a standard New Zealand power outlet is 220 volts, but remember that A, that's alternating current, and B, the skull is actually really good at stopping electricity, which is called impedance. This means that only 1% of that electricity makes it to the brain tissue, which is not a lot at all. When this ECT dose is given, the brain will have a temporary seizure, where the electrical signals go into an unorganized, erratic pattern. But fortunately, the brain has its own anti-seizure mechanisms, so the seizure stops pretty soon afterwards on its own. Once the seizure is stopped, the anesthesia is reversed and the person wakes up. Just like after any procedure, like having your wisdom tooth removed or an abscess strained. And voila, ECT completed. ECT is often not a one-time thing. There will be follow-ups with the psychiatrist to see how effective the first session was. Then more ECT might be given in the coming weeks, or a course of antidepressant might be given for ongoing improvement of the depression or whatever the ECT was given for. In general, most people receive about 6 to 12 sessions of ECT in one course. Studies show that if you give one session of ECT, then a course of antidepressants, people have a 50% remission rate, as in half the people will relapse into the severe depression. But if you give follow-up ECT sessions as we do in a standard course, then that rate drops to 37%, meaning only a third of the people relapse. Again, it doesn't sound amazing compared to some other treatments in medicine, but it's still a huge effect in the world of psychiatry, where we're still learning to develop effective treatments. It's one of the most effective and quickest way to pull someone out from severe depression or catatonia that we have. Alright, so before we talk about how ECT actually works on the cellular level and what kind of side effects can occur, let's do a quick recap. Electroconvulsive therapy is all about delivering enough of an electric shock to the brain to cause a seizure, which seems to be a surprisingly effective and fast way to treat multiple mental health problems. Because having a seizure is not a fun experience and can cause some real bodily harm from the flailing around, we put patients to sleep first with general anesthesia, which as part of it includes paralyzing the person with a muscle relaxant. Then, a psychiatrist trained in ECT will attach sticky electrode pads onto both temples of the patient, hook it up to a machine, which gives increasing doses of electricity, until there's changes in the brain waves indicating that a seizure is happening. Lastly, the doctor chooses an electricity dose higher than the seizure threshold, shocks the patient's brain for around 1,000th of a second, and once the seizure settles, the patient's woken up again. We repeat the same dose over multiple sessions until the patient has been treated adequately and is feeling better. Okay, so let's talk about the elephant in the room. How the hell does electricity help the brain, especially with something as complex as mental health disorders? When we shock a person's heart, called defibrillation, we're doing something very specific. We're overriding the heart's electrical system so that the noise gets suppressed and the heart's own pacemaker can take over with a normal rhythm. But the brain doesn't run in the same way as the heart. Instead of straightforward electrical wire circuits, the brain is more like a super complex tangle of electrical switches called neurons, all connected to a bunch of other neurons. And somehow, the pattern of on and off between these neurons result in us being able to move our fingers, remember the super catchy 1987 pop song Never Gonna Give You Up in its entirety, and produce all of your thoughts, feelings, hopes, dreams, and anxieties. So you can't just turn it off and on in the same way. Or can you? Interestingly, we aren't 100% sure yet exactly how ECT works to treat depression and mania and psychosis and all of that. But there are a few promising theories. Broadly speaking, researchers think there are two prongs to how ECT works. Firstly, there's the short-term effect. There are 3 different theories that try to explain how ECT immediately reduces symptoms in patients, and all of them have something to do with neurotransmitters. Let's do a super brief, simplified lesson on how the brain works. Like I mentioned before, the brain is made up of around 80 to 100 billion neurons, specialized cells that can conduct electricity through themselves with the clever use of sodium and potassium ions. Each individual neuron can't do much, but what they can do really well is connect with each other. So well, in fact, that on average, each neuron connects to about 7,000 other neurons. All in all, the human brain has somewhere around, wait for it, 1 quadrillion connections! For all the cool kids out there, that's 1 followed by 15 zeros, or 1,000 times a million times another million. To put that in another perspective, a quadrillion seconds is 31.7 million years. It's massive. Side note, our brains, despite their quadrillion connections, aren't very good at processing large numbers. So a lot of people treat millions and billions just as some ludicrous number. But 1 million seconds is only 12 days, whereas a billion seconds is 31 years. And you need 1 million of those billion seconds just to make it to a quadrillion. Anyway, that's enough maths geeking out. Let's go back to medicine geeking out. These quadrillion connections allow the brain to act as a kind of hypercomputer, because you can turn different neurons on and off, and this translates to all sorts of different patterns. But for today's purposes, what we're really interested in is what happens in one of these neuron-to-neuron connections, called a synapse. An electrical current can run through one neuron because it cleverly pumps charged ions in and out of itself, directing the charge from one end to another end. But the neurons aren't directly touching each other, so the electrical charge can't just jump from one neuron to the next. To solve this problem, neurons use neurotransmitters, which are essentially chemical messengers. Think of it like this. If you want to do a Mexican wave, but you're all blindfolded and your hands aren't touching each other, how would you do it? Obviously, you need a way to tell the next person that you've finished your own wave and they need to start their wave. So you simply shout at them as you're finishing a wave. If the next person hears your voice, they'll start their wave. Then shout to the next person when they finish their own wave. Neurons do a similar thing, but with chemicals instead of shouting, "Alan!" When the charge reaches the end of a neuron, it triggers a process where pre-made packets of specific chemicals to be released by the neuron. When the charge reaches the end of a neuron, it triggers a process where pre-made packets of specific chemicals are released by the neuron. You might have heard of some of these. Dopamine and serotonin are pretty famous, but there are some other important ones with harder names like noradrenaline and gamma-aminobutyric acid, or GABA for short. Anyway, Neuron 1 releases these neurotransmitters into the gap between itself and neuron 2, which is the synapse. Eventually, the neurotransmitter wafts over to neuron 2 like a fart, where it binds to specific receptors that it fits snugly into. When this happens, neuron 2 is woken up like a light switch got flipped. It starts doing its own Mexican wave and transmits the signal to the other end, where more neurotransmitters get released into another synapse, and the chain continues. To bring it back to mental health, we now know that depression isn't just a funk you get into because a sad thing happened. It's so much more complicated than that. We know that when someone is depressed, or pathologically anxious, or psychotic and hallucinating, there is an imbalance in these neurotransmitters. It might be that their neurons aren't producing enough serotonin, or their neurons aren't sensitive enough to noradrenaline, so the signals aren't being transmitted effectively enough. Alternatively, some neurons might be a bit too active, causing chaos. There's also a growing evidence that depression may cause neurons to have stunted growth in a simplified sense. So, if you want to reverse the negative effects of depression, we need to restore the balance, whether that be helping the neurons produce more neurotransmitters, or by helping them grow normally. And that's what ECT does. We know that when ECT is delivered, the brain releases more dopamine, serotonin, and noradrenaline. Furthermore, it makes the neurons more sensitive and makes them appreciate the simple pleasures and beauties in life. I mean, it makes neurons more sensitive to neurotransmitters, but same difference. So they respond better. This might explain why people who didn't previously respond to antidepressants do benefit from them after ECT sessions, because the neurons are now more sensitive. There's also evidence to suggest that the electricity stimulates the brain to release certain hormones, including endorphins, while improving blood flow to the brain, that can also help with restoring the balance. Lastly, remember how we talked about the brain having its own anti-seizure mechanisms? Well, it turns out this process itself also helps restore neurotransmitter balance by stimulating GABA, which is a neurotransmitter that actually tells neurons to chill out more and deactivates them. We think that this anticonvulsant effect might have a big part of how ECT works, rather than the direct effect of electricity itself. One way or another, ECT seems to help recalibrate the brain so that the connections run smoother and less rattly. Kind of like WD-40ing the entire brain. But there's a second thing to talk about, the long-term effects, and this is the juicy part. Studies have shown that ECT directly causes brain tissue to heal. That's right, they've noticed that electricity can actually stimulate brain cells to grow, relearn, and repair damages in the long run. This is called the neurotropic effect, and it might be one of the reasons why ECT might work to help people not fall back into depression again. It also has the benefit of cancelling out some of the physical brain damage that comes with severe depression, so it's pretty wonderful, really. Figuring out the mechanism of action of ECT is still an exciting area of neuroscience that's developing, so watch this space. But for now, just remember that all of this is only when ECT is done correctly. So don't even think about connecting yourself to a car battery to give yourself super intelligence. You'll die instead. Alright, let's talk about one more thing before we take a break. So far, ECT is sounding super effective and exciting, but are there any downsides? Well, like every other treatment in medicine, there are potential side effects. Most of the common ones are annoying but temporary, and mostly associated with being put under general anesthesia, like nausea and muscle aches. Many people also experience some short-term confusion and headache afterwards, but this all settles down within the first few hours. But the most important side effect to talk about that people worry about is memory loss. Since the advent of ECT, doctors and patients noticed that after ECT, people sometimes reported having trouble remembering things afterwards, or forgetting details of things that happened just before the treatment. In the early days, it was actually considered a good thing, because patients would forget the horrendous times of having severe symptoms of their mental health illness, or being shocked without muscle relaxants or sedation. But even now, with improved techniques and dose modulation, memory loss is still a recognized side effect of ECT. It doesn't happen all the time, around 25 to 30%, which is still pretty common. The memory loss can be what's called anterograde amnesia, or having difficulty forming new memory, or retrograde amnesia, where you forget things that have already happened. Fortunately, a majority of memory-related side effects from ECT are quite short-lived, only lasting about 2 to 4 weeks. If anything, on average, people seem to have improved memory after 6 months, because you know what else causes memory loss? Severe depression. So fixing the depression can improve memory, cancelling out the adverse effect of the ECT. That said, there are still a proportion of people who will experience some degree of persistent memory impairment. In very rare cases, it can even affect autobiographical memories, like key moments or information from your life. But luckily, this seems to be very infrequent, which means that many patients and clinicians find that the risk of memory loss is lower than the risk of harm from letting the severe depression, mania, or psychosis continue. Alright, that was a huge amount of information. But hopefully now you understand what actually happens during an ECT session and how we think it might work. I still remember the first time I got to observe ECT sessions while learning psychiatry in med school, and it was so different to what I thought ECT would look like. It wasn't a barbaric forced procedure performed in a dimly lit room with security guards holding someone down. It was like any other surgical procedure, in a well-lit room with friendly nurses and doctors, explaining the procedure to the patient and gaining their consent, then gently putting them off to sleep before giving a very calculated dose of electricity, carefully calibrated to match the patient's own brain sensitivity. Instead of horrific full-body convulsions, the patient would lightly jolt and maybe twitch their foot slightly for 10-20 seconds, but largely be still thanks to the paralysis. When they woke up from anesthesia, they had no recollection of the shock because, well, they were anesthetized. I'll include a video in the show notes that does a very good job of showing visually what the journey looks like for a patient receiving ECT that I strongly recommend that you watch. Because, as wonderful as a treatment ECT may be, it has a dark side to it. It's past. And because of this past, people are still abhorred by even the mention of it, which impedes people being able to talk about or access vital treatments that might literally save their lives. But first, let's take a short break. And when we're back, we'll go over the history of ECT and why it has such a bad name. Welcome back. Alright, so by now, you're probably getting the hint that ECT isn't the most loved medical treatment in the eye of the general public. To understand this, we first need a brief history lesson on how ECT started and its early days. Electroconvulsive therapy was invented in 1938 by an Italian psychiatrist named Ugo Soletti. Even before Soletti, the concept of using a seizure to treat psychiatric conditions had been around all the way back to the 16th century. In the early days, medications such as insulin or camphor were used to induce a seizure, but this was very risky and came with many adverse effects, with a lot of patients dying from the procedure rather than being helped by it. During the 1930s, Soletti experimented with applying electricity to the brain to induce a seizure rather than a chemical. Now, you have to understand that we're talking about the early 20th century, when psychiatry was at its infancy, and medical ethics was, for the lack of a better way to put it, not really a thing. We're talking about an era where we had such little understanding of how mental health worked, such as depression, mania, addictions, and schizophrenia, that doctors were trying all sorts of things to try and help their patients. This included putting them in hot tubs, talk reason into them, heavily sedating them with medications, pulling all their teeth out, or even intentionally destroying a part of their brain with surgery. And for even more context, the person who invented lobotomies got a freaking Nobel Prize for it in 1949, because it was argued that it was a highly, quote-unquote, effective treatment for severe mental health conditions in a time when no reasonable alternatives were available. It really was the equivalent of old-timey doctors applying leeches to their patients, or using lavender to ward off diseases. That's how new the field of psychiatry was, and how little we knew. Then again, that's how medicine has evolved over the times. We build up our knowledge through experience and research and new discoveries, until our old practices seem barbaric and outdated. Who knows what treatments from modern medicine will be looked back on with disgust in 100 years. So although we absolutely should acknowledge that horrific treatments were done to mental health patients, often against their will, we have to respect that we have the benefit of the retrospectogram. With 100 years of medical advances and ethical guidelines and better understanding of mental health before criticizing the past too harshly. Anyway, with that contextual preamble out of the way, let's go back to ECT. Soletti discovered that his electric shock therapy was highly effective in patients with crippling depression and catatonia, many showing marked improvement in their symptoms within the first few sessions. Even then, he noticed a common side effect was retrograde amnesia, but it was actually considered helpful back then because it helped people forget the worst moments of their psychiatric illness while being in hospital, along with having electric shocks as a therapy. This is not to say that people would forget everything, or that they forgot they were depressed. a lot of the amnesia would reverse itself with time. ECT quickly caught on with other psychiatrists who were able to replicate the results, and the procedure became more fine-tuned to discover the optimal electricity dose and how it could be administered safely. However, back then, they didn't have safe ways to anesthetize people like we do now. The first muscle relaxant medication, suxamethonium, was only developed around the 40s. Before this, patients had to receive ECT while awake and not paralyzed, which could cause violent enough seizures that they could have broken bones, not to mention all the muscle aches that came with the convulsions. This is about the era of ECT that the book One Flew Over the Cuckoo's Nest depicts, based on the author's experiences of working as an orderly at a psychiatric hospital. Fortunately, by the 50s, general anesthesia and muscle relaxants were becoming widely available and safe, which meant that ECT could be given with the patient unconscious and paralyzed to prevent the full-body convulsions. By the 1970s, psychiatrists had also come around to the need for better ethical and procedural guidelines, because ECT was being misused by various institutions against the patient's wishes and without a good clinical reason, or even on people who didn't have a severe mental health condition that required ECT, such as people of the LGBTQ community. Remember that this is an era when homosexuality was illegal in many countries, and considered a sexual disorder even in the formal criteria of mental health conditions, a horrifically outdated line of thinking that we're thankfully moving away from. Anyway, the 70s is when there were more strict guidelines on when ECT should be used, and how it was important to obtain consent from patients, or at least have a good clinical reason, as in the person didn't have the capacity to make sound decisions due to their severe illness affecting their ability to think rationally, or they were actively a danger to themselves or others if left untreated. Most countries have legal systems to help with this decision-making process, such as the Mental Health Act. But unfortunately, from a timing point of view, the film version of One Flew Over the Cuckoo's Nest came out in 1975, based on a book that highlights psychiatry from the 40s and 50s. And because the movie's so damn good, argued it's one of the best movies ever made, many people watched it and left a strong impression with the general public that this is what psychiatry was at the time in the 70s. It coincided with a time where there were many anti-psychiatry movements happening, so all around there was a lot of psychiatry bashing at the time, whether it was for legitimate reasons or not. So even though psychiatry was evolving and moving away from the kinds of practices depicted in the novel, progressing towards better treatment of their patients, the public image of psychiatry was becoming more and more sour. And it's difficult to defend all of psychiatry because these terrible things did happen, and were still happening, just less and less. All told, more than 40 years later, when we have modern ECT protocols delivered in an extremely safe and effective manner, with strict ethical and legal guidelines on obtaining consent, people still see ECT as what it looked like in the 1940s. It would be the equivalent of if you told someone they needed surgery to take their appendix out, and you assumed it would be done without anesthesia, with a surgeon who hasn't washed his hands before doing the surgery. Or thinking that because you've watched Master and Commander, that when you go into hospital requiring an amputation for a diseased limb, that they're going to do it with a hacksaw while you bite down on a piece of wood. The other problem is that, like with many other things in the world, you will most often hear about the bad things more than the good things. So even now, people have terrible images of antidepressants and ECT because they hear online of people having horrible side effects like feeling numb, memory loss, and so forth, while not seeing the vast majority of people who benefit from these treatments or suffer minimal side effects. There are countless stories of people who suffered from severe depression and on the brink of suicide, who were able to recover and regain their ability to live their lives thanks to ECT and other psychiatric treatments. But they couldn't talk about it in public because they'd get shouted at by people who are so against the field of psychiatry, largely due to its bad public image. This results in an echo chamber, where people talk about only the bad experiences of psychiatry, without people being able to talk about the good experiences safely, so public conceptions of psychiatry just got worse and worse. Ultimately, people are less able to access treatments that would help them, because they are scared of it or convinced away from it by people who aren't professionals in the field and filled with misconceptions. I think if you met even one patient who went through ECT in real life, as in 2022, not 1942, it would make you rethink your views on it, because they tell you just how much of a difference it could make. I've talked to patients who went from not being able to get out of bed or even eat a single bite of food, with no intent on being alive, to being able to enjoy their life, their relationships, their jobs, their hobbies, and actually have hope for the future. When you see how much damage mental health conditions like depression and anxiety can do to a person's life, you also come to appreciate the contrast and improvements that effective treatment can provide. So I think this is a great reminder for you to prioritize mental health, both for yourself and your loved ones. Remember that it's okay to seek help and to want to be better, because you deserve to be healthy and to be able to live your life. And thankfully, we live in an era where we have safe and effective treatments, even if it might take time and trying different approaches until you find what works well for you. If you have concerns or questions about mental health, I strongly recommend that you talk to a professional such as your family doctor or a licensed therapist, not going on the internet. The biggest barrier to mental health treatment is the stigma and social pressures that surround it, much like what we have been talking about with ECT. Why should you miss out on getting the help you need, whether it be talking therapy, medications, or even electroconvulsive therapy, because of what people who have no experience in the matter have to say about it? Let's call it a show there. I hope this episode helped clear up some misconceptions you might have had about ECT and psychiatry in general, and spark some interest in people doing more research and thinking about it, so you can form your own opinions based on facts. So, what did we learn today? We learned what ECT is, the use of a brief, controlled small electrical pulse on the brain to cause a seizure, which helps treat people with severe depression or schizophrenia. We learned the process of how ECT is given, from obtaining consent to putting a person under anesthesia, to how the electricity is actually delivered. We learned how ECT, and in fact how the brain, works, by improving neurotransmitter balance and letting the brain run more smoothly, and healing brain cell damages caused by mental health conditions. We learned about the safety and effectiveness of ECT, and how it is supported with data from very rigorous studies to back it up. We learned that despite how safe and effective it is, ECT still is quite unpopular with the general public, because it had a very rocky start in the mid-1900s, due to lack of general anesthesia, ethics guidelines, and strict indications to guide doctors. We learned how media portrayals can affect the public view of certain parts of medicine, for better or for worse, and why it's important to do our own research to learn the facts and truths without being swayed by misconceptions and other people's opinions, which lets us navigate the grey zones of life in a safer way. Lastly, we learned that mental health is very, very important, and you should definitely prioritize looking after yourself and your loved ones by not being afraid to seek help and engage with mental health professionals, whether it be a therapist or a psychiatrist. Alright, for today's 2-Minute Explain, let's talk about another electricity-related technology: induction. Many of you might have an induction hob in your kitchen, a simple-looking black plane of glass that won't burn you if you touch the hob directly, but it still heats up your frying pan or pot. To cook something, we often need a hot surface. Traditionally, we would do this by heating up a pan or a pot directly over a fire, in the case of a gas stove or a barbecue, or a hot element such as an oven or a ceramic hob. But we're increasingly seeing more induction hobs in people's kitchens, which is peculiar because it doesn't heat up by itself, but it does heat up a pan or a pot that's on top of it. Unlike other cooking methods that use direct heat to heat the cooking vessel, induction uses magnets. Oh yeah, baby, it's time for more magnet science. If you listened to our last episode, you now know how magnets work, and how you can create a magnet with electricity. And we also talked about how by that same logic, you can create electricity with magnets. Well, this is how induction cooking works. An induction hob or cooktop has under the surface a coil of copper wire. When you turn it on, an electric current passes through the coil, generating a magnetic field. But you probably already know that you can't just put a magnet close to a metal to generate electricity. It just sticks to it. If it's ferromagnetic, of course. To generate electricity, you need a magnetic field that is constantly changing in direction or strength. So, if you put alternating current through the copper coil, which handily is the kind of electricity most of us use in our homes, then you have the coil constantly flipping between two kinds of magnetic fields. It's like turning your lights on and off really quickly, like you're about to give someone with photosensitive epilepsy a seizure. Now, if you put a metal on top of this coil that's ferromagnetic, such as a cast iron pan or a stainless steel pot, then the rapidly cycling magnetic fields causes the electrons in the metal to get really excited and swirl around. Hey, that's electricity. And you know what electricity is good at? Heating up things. Just ask any household appliance, from heaters to toasters to ovens to light bulbs. The movement of electrons through the iron generates heat energy, which is super useful if you want to fry an egg or boil some water. Because induction relies on magnetism to work, you can't use it on non-ferromagnetic metal things like copper pans, aluminium pots, or your hand. Whew. It's one of the useful things about induction stovetops. They're a lot safer because they don't heat the stovetop itself, and won't burn the kitchen down if it's left on with nothing on top of it. It's also generally more energy efficient because the energy goes directly into heating the cooking vessel, not the stovetop or the air around it. But it also has some downsides, like price, and it can only heat the metal touching it, so it's not very useful for certain kinds of cooking, like stir-frying on a wok. So, there you go. We now live in a future where we can cook a delicious steak with magnets. Woo! Well, that's it for today. Thank you for listening to Explain This. I hope you've learned something interesting and maybe even useful today. And thanks again to Siggy who suggested this topic of ECT to me. If you have any topic suggestions, feel free to email me at explainthiscast@gmail.com or leave a comment on any of our social media pages. We'll see you next time. Bye for now. Explain This was written and hosted by me, Jin Kim. If you'd like to suggest a topic or just send a lovely message, you can email me at explainthiscast@gmail.com or follow me on Facebook or Twitter